And open the meeting of the Potter Valley Healthcare District. Believe that's right. Yeah, okay. Rosie, if we can get a roll call.
Director Cox? Here. Director Red? Here. Director Gallagher?
Here.
And, Director Patel?
Here.
Attorney.
Here. There was no closed session for the district today. Any agenda modifications for consideration from staff? Okay, seeing none, I'll now open up the I'll move to public comment, open up the public comment session on matters not on tonight's healthcare district agenda. Anyone wishing to speak on items not on tonight's agenda?
Don't have the line.
Okay, anyone in public with the public here? No. I'll now close down the public comment and open it up to public comments from our board members. Okay, seeing none, I will move on to the consent calendar. We have 3 items. One is our minutes approval for the June 25th, 2025 meeting. The other one is a CFO report that we received in the Watsonville Community Hospital Board meeting just moments ago. And the third is the Potter Valley Healthcare District policies. Any questions for staff about either of those 3 items before I open up the public comment? Okay, seeing none, I will open up the public comment. Any raised hands online for this item?
Don't have the line.
Okay. Anyone wishing to speak on the consent calendar in person? Seeing none, I'll close down the public comment and I will entertain a motion for the consent calendar.
I'll move approval, just to appreciate the policies that were brought forward, the foundation framework. Second.
Thank you, Director Patel and Gallagher. I'll take roll on this item. Director Cox? Yes. Director Friel?
Yes.
Director Gallagher?
Yes.
Director Pimentel?
Yes.
And Attorney.
Yes. Okay, that brings us to item number 4. It's our only discussion item of the night, and it's Coastal Health Partners update. Lupe, whenever you're ready.
Good evening, everyone. For those of you that don't know me, my name is Lupe Mendoza. I'm the Director of Clinic Operations for our district clinic, doing business at Coastal Healthcare. And so our first slide here, just sharing our mission. Coastal Healthcare is dedicated to identifying the meeting and changing healthcare needs of Santa Cruz County and the surrounding communities. We are committed to providing quality services within a safe and caring environment where our patients feel supported, respected, and this mission is guides our day-to-day operations. This next slide, we shared it in our last presentation. I left it in here just in case we had any new board members, just to kind of go over past and present, where the clinic was and where we're at now. And so previously, the clinic was under Coastal Health Partners, a professional corporation, and it was managed by Watsonville Healthcare Management, a MSO under the same umbrella as Watsonville Community Hospital. It handled all the administrative and operational side of the clinic services. That MSO, Watsonville Healthcare Management, was also part of bankruptcy filing, which significantly disrupted our operations and led to the complete structural and contractual reorganization. And so with that formation of the district, we saw an opportunity to reorganize. And as of September of 2022, the clinic was reorganized and redefined as a district clinic under California Health and Safety Code Section 1260. In this model, the district contracts directly with the physician group known as Coastal Health Partners to provide all the professional services to the clinic's patients. Very important to note that, again, Potter Valley Healthcare District and the district clinic doing business as Coastal Healthcare is one and the same. Here we'd like to highlight again the structure as of September 1, 2022. Oh, sorry, you guys won. I did. The corporate structure as of September 2022, you'll see in the orange box the district, and within this district, again, like I said a minute ago, the 1260 district clinic within the same. The blue box here will show you that because the district cannot employ either physicians or support staff, our staff that support the clinics are actually Watsonville Community Hospital employees for then leads to the district clinic to support the clinics, the physicians. We then have Coastal Health Partners linked to the district clinic through a exclusive professional services agreement to provide professional services to the clinic patients. There's an organizational chart. To the right, you'll see, again, the district, the board of directors yourselves, followed by Steve, our CEO, and then myself as the director of clinic operations. And then two key members below me, Sandy Hamilton Clark, our billing manager, credentialing specialist, and many other things. And then Olvida Quintana, our clinic supervisor. To the left, we have some of the operational challenges listed, and such as outdated policies impacting efficiency, lean staffing, limiting capacity for improvement areas, and of course, recruitment challenges, which we'll talk a little bit more about that. These are our clinic locations. Although you'll see 3 pictures, there's actually 4 locations. 2 of our offices are here on campus in the 65 Nielsen Medical Office building. So we have a total of 4 locations, 2 on site, 2 off site. Here's meet our providers, the roster, with all of our 10 physicians providing services in the clinics, providing GI, primary care, general surgery, urology, podiatry, which is a physician who's currently on leave, and GI and primary care services, which is our newest addition. A few physicians that you don't see on this roster are physicians who provide hospital-based only services on the hospital side, providing palliative care as well as pulmonary critical care. How are we doing? Financial performance. So this slide shows the clinic's financial performance for 2025 year to date through June, compared to 2025 year to date budget. The 2024 column here is a full year figure. It is only for transparency, but it's not directly used to compare. So we're just looking at the 2025 year to date and compared to the budget. And so you will see that net operating revenue through June 2025 is 18% below budget, indicating lower income than projected, obviously. And total operating expenses, 13.4 under budget, which reflects good cost control. Overall, the net operating loss is better than budgeted by 7.7%. So it shows that we're managing expenses well, even though we continue to work to improve revenue. This graph here was also made by Steve, and so it shows us unique patient visits by month. So again, unique patient visits, not total visit encounters. So any one patient that's accounted for here once could have been seen 10 times by same physician or various physicians, but they're only accounted for once. So you'll see that in June of 2024, we peaked, followed by a decline, which aligns with the loss of 3 service lines: ortho, podiatry, which is a physician who's currently on the leave, and then infectious disease. In January, the volume again increased, and the reason for that, I believe, is the addition of primary care services. And since then, it's remained somewhat stabilized. Clinic strategic analysis. As we all know, we operate in a very highly competitive environment with large systems who refer internally. One of our major gaps is strong primary care base to refer patients to our own specialists. But this is something that we worked on, and like I said a minute ago, we did add primary care earlier this year. Recruiting providers remains difficult, again, due to being in a rural location, competition from higher paying systems, and also cost of living. payer environment, we've made a lot of progress. Earlier in 2024, we were able to increase our contracts by over 50%. It's now been over a year, so it's a good time to revisit and potentially look for opportunities to renegotiate some of those contracts as it's been well over a year. This slide actually is one of the slides that is Wassamo Community Hospital Strategic Plan. And the reason why I left it and added it in here is just to show that, again, our key milestones are so aligned with the clinics. And in this timeline, you'll notice that the hospital was looking to recruit 2 family physicians in the second half of 2025, but we were able to do that in the beginning of 2025 in January. Strategic priorities. This outlines coastal healthcare strategic priorities between 2024 and 2026. In three different key areas: primary care development. And in that area, we have made some improvements. We've increased our bonus structure, and we've also been working on putting together a 401k plan, which is something that we did not offer our physicians. And it was something that constantly came up during our recruitment efforts. And we are getting ready to launch that in the next couple of weeks. So we're happy about that addition to our recruitment package. Internal restructuring, we're looking to explore different ideas, potentially making physician shareholders of Coastal Health Partners, and also adding non-physician personnel to improve capacity of administration with our growth. And maintaining payer and provider relationships, of course, it's something that we are very focused on, and also building on relationships with partners who are very important to us, such as Central California Alliance for Health, and working particularly with them in regards to incentive programs and recruitment grants, which we are actively engaged in, as well as continuing to solidify relationships with Salud de la Gente. One example of something we've done is that they're expanding specialty services in their clinics, and we've partnered with them to provide some specialty services for them. So we have a couple of physicians who go down to the clinics and see their patients there. Downstream from KP and Dignity, we've made some progress there as well. We don't see many referrals from Kaiser at all for our clinics, although we are contracted to see their patients. However, recently with the addition of GI, we've been able to secure referrals coming directly in for our clinic for GI services. And with the addition of primary care, we're now seeing a lot of referrals for primary care from Dignity as well. Here we are highlighting recent progress in provider recruitment and development of primary care and specialty service lines. We added Dr. Robico. He joined us providing internal medicine services again in January 1st, 2025, followed by Shannon Classen. She's a family nurse practitioner who joined us June 1st, and she is Spanish speaking, so that was a great addition to our team. Dr. Janet Agamini joined us in May of 2025, and she's providing hospital-based only palliative care services. Dr. Chad Matawar joined us late in 2024, and Dr. Non will be joining us next month in August, and they are also providing hospital-based services only to the clinic for pulmonary critical care services. We are actively recruiting for neurology, GI, primary care, orthopedics, and general surgery. Good news, we have identified a couple of candidates to fill some of those needs. And the first one is Dr. Jennifer Etchison. She's an orthopedist, and she has already been presented with an employment agreement that she's currently reviewing. And then we also have Dr. Robert Allen. Dr. Robert Allen is a general surgeon who has also already signed a letter of intent, and we are putting together right now an employment agreement to present to him. He will be replacing a general surgeon who's actually leaving our group, Dr. Sarah Brandt. Her last day is actually tomorrow. And so we definitely have a need to fill that position. So as you can see, this recruitment activity is a strong sign of growth and strategic investment in rebuilding and expanding essential services. Here we outline the core strategy for ensuring long-term success for Watsonville Community Hospital and highlight some areas of work that's already underway. The success of the hospital is dependent of strong medical staff with a focus to continue primary care growth. And we need to continue to improve our physician recruitment packages, making us competitive, which we've done a little progress on. Coastal Healthcare can provide that practice environment, but it's going to need to require investment both financially and operationally. And we are seeing a positive momentum and recruitment at this time. Question?
Any questions for Lupe? I don't know if you, but
Comment from my end.
please, yeah. go ahead.
Okay, I would imagine, you know, the graduating class at the Tiverton at the residency, people start looking in the fall, so rather than just the general recruiting efforts, it would be time well spent, make a specific, whatever it is, thanks, outreach for the Tiverton.
Okay.
They may already have houses, you know, the other obstacles, like the area, et cetera, et cetera. So,
Thank you. I'll bring
Yeah.
that up.
Any other questions or comments, please?
On the slide with visits, Dr. Rob, maybe I was presuming too much that Dr. Rob would bring kind of his book of clients and patients with him. But I didn't really see like a growth spurt following his, did they come and we had other patients that brought, I mean, I guess I'm asking, like, I don't know if I can ask, like, did he bring a lot of patients with him?
How does, yeah, so we saw that road, that peak, because he, as you know, as you may know, he is an established physician in the community. He's been around for about 30 years. And, when we reached out to him, he was actually looking into retiring. So he had already let go of a lot of his patients, he had already terminated some of his contracts. So he didn't have a full clinic anymore, but he did have enough to make an impact, as you can see in January when we saw some growth. And a lot of the patients that he had lost as they're learning that he actually is sticking around, as joined us, we're starting to see some of them come back.
Okay.
He had already lost all of his dignity patients, but again, we're starting to see them back. This month, we saw 30-some patients back to us.
Great.
And we're having some growth there as well.
Thank you.
I might just add a comment to that, because I was recently just kind of looking at the payer mix of the clinic and kind of asked about Dr. Otto's especially, and his payer mix has significantly strengthened the overall payer mix. His is primarily commercial and Medicare.
It is.
Yeah.
It is. We actually just signed our, we passed our facility 70% of health and Alliance for Health, so we're currently not seeing any at all. So it is mostly commercial and Medicare.
Great. Any other questions? I have a couple of questions. For Dr. Ravago, as Marcus was saying, and as you just said, the idea was, or at least the way it was introduced to me was he would love to hand over his patients to a good physician that would then help Watsonville Community Hospital. And he was kind of doing it as this is my gift to the community. Do we have a timeline on when he's, I don't know, going to hang up the stethoscope or whatever we want to say?
So, so when he first joined us, we only signed him for a year. So it'd be through 2025.
Okay,
However, he's pretty happy with us.
great.
And I was just going to speak that today. You know, we're still recruiting to add a position to replace Cam.
Right.
Because our second provider is a nurse practitioner.
Mhm.
And he's talking about sticking around for a while. So there's some decisions, conversations that we need to have about that. We did only engage with him for 1 year.
Okay. Send him a box of chocolates or whatever. That'd be great. And then, so I think you might have just answered this, but the patients that are coming from Dignity and are being referred to Dignity, to the primary care docs, the mix of that, I'm guessing is not Medi-Cal, but it's mostly commercial
From the
patients coming from Dignity,
commercial.
just commercial, okay.
Yes.
Great. And then, yeah, I'm wondering, you don't have to go too much into the strategy or the tactics that we're using, but just my curiosity, what's working in terms of recruiting physicians that you've seen? And just overall, I guess more of a question for staff.
What's working, what are we doing?
Yeah,
So,
it's so challenging, right, to bring
so
new
challenging.
positions into the county, let alone to an independent provider like us. So I'm just wondering what you're seeing is working well.
Well, I think for primary care, what really helped, because we had been looking for a little while, what really helped was that, it was very challenging to get a physician to join us when we were starting essentially from scratch.
Mhm.
So that changed once we had a physician who was already established in the community and they had a home to come to that was already up and going. So that really helped to bring on the family nurse practitioner.
Mhm.
In terms of the other physicians that we recently recruited, and hopefully will be joining us soon, I think it's a number of things. One is we have a recruitment company that we work with that has done a really good job at presenting many candidates for us to interview and select from. And then we also did improve our recruitment package a bit as well. Like I said, we increased our bonus. We are able to say that we have a 401k that we're going to be able to provide to them. So it's a number of small things that we've done.
Okay.
That I think have really made an impact on our ability to recruit. Also, the two physicians that we recruited, well, one of them is local, she's from Cupertino, so she wanted to come back close to home. She loves Santa Cruz, she's a surfer, so that's something that I'm always looking for,
Mhm.
you know, do they have ties to the community? That's so important, because otherwise they're gonna come, they're gonna stay for a couple of years, with a
Right.
guaranteed salary, and then, you know, and away they go. And, our other candidate, he's coming to us from, West LA, he was, working for Kaiser for a couple of years, and his wife just, signed a contract locally as an OBGYN. And so he was coming here regardless, it was just a matter of who he
Right.
joined, so that definitely helped out as well.
Okay, Steve, you were gonna say something.
I will say too that the fact that we have primary care now has been a selling point for the surgeons, right? They both candidates asked about that, like how do we get referrals? And we talked about, well, this isn't gonna fill your entire practice,
Right.
but we are building primary care. We have 2 providers now. We're gonna be adding more. The idea there is that that's a built-in referral source. So they were happy to hear that that was part of the plan and part of the strategic plan moving forward.
Definitely, I think that's also added to having stronger conversations with the candidates during the interview process.
What's the capacity for primary care there? How many docs would we be?
I think we could fit 2 more in that building.
At the allocation, yes, we can definitely accommodate for it, it's a pretty large location, it's over 3,000 square feet,
Okay.
and we're definitely only utilizing half of it right.
June just left the room, but if someone can donate a house to us, there you go. I imagine that's when you get into conversations, but especially with primary care docs, that's for any docs, I guess.
Yeah.
Yeah.
That's number one, is like, I have to buy $1 million house just to go practice medicine here. I imagine, right?
Yeah, you gotta just sell them on the, it's beautiful here, it's worth every penny, it's okay. You know?
Right, okay. So hopefully June felt a shiver down her spine or something.
Hopefully. If not, we'll measure.
Yeah, please.
Chairman,
Yeah, please.
asking from a patient volume and demand perspective, do we have enough, what I would say, quality commercial payers lined up? If we bring in providers, will the demand be there, especially on the commercial side, to fill up their days? Or is it something we still also have to work on the demand side and getting more people aware of what coastal health can bring to
Yeah, I think there is some work that needs to be done to bring in more volume. And there's some things that we've talked about, you know, there's some financial constraints right now, but there's some
Yeah.
marketing tactics that we can use and, you know, business to business type of presentations, trying to connect with local companies and where are their employees going, trying to get in there and say, hey, we're here. So getting the word out there. Right now, we're very, very reliant on word of mouth.
Yeah.
And so we need more than that.
between the school and the city
Yeah.
and all employees who work in schools and cities in Watsonville who live here.
Where are all these patients going? They're either going up north or
Yeah,
they're going to, you know, bigger
yeah.
companies here, Dignity and Anthem, they all have a presence here in the area, so.
Talk to Steve about this in terms of Medicare. Neither provider in North County accepts new Medicare patients. I think Sutter was in some ways culling their Medicare patients. I knew it was. I think of it as a volume problem for the hospital, like any volume is better than no volume. But I know you say Medicare doesn't pencil out for the hospital, but I would think there's an opportunity to bring patients from North County who are looking for, who have Medicare, who are looking for.
Yeah, yeah, I think all the medications that,
You are,
yes.
We are,
Good enough.
No, control.
all right, good.
And if we had some cash, we could advertise about all that stuff, right?
Yeah.
Yeah.
That's part of the challenge is that like, we are kind of reliant on the free advertising right now, word of mouth and going around and talking to people.
We're doing a little social media too, but you know, we don't have a lot of traction there just yet.
Right.
And hopefully soon we'll be able to work on our Google reviews, just like Nan showed you earlier. I'd love to see some progress for us there as well. We're actually looking at that now.
I mean, I think some targeted things like the oncologist in North County might end up having patients who are looking for primary care. So cheap, easy Xerox things to put on their bulletin board kind of stuff, or some phone calls to their office managers.
Yeah. Thank you.
If someone were to wanna sign up for primary care there, just walk through the door? Or-
Accept patients same day, so we've got flags out there saying accepting new patients and just phone call to our office and we can accommodate a visit with either provider.
Cool. Any other questions for Lupe? No? Okay, well, thank you so much. Appreciate it.
You're
Yeah. Thanks, Lupe. That's our last item of this meeting, so I'll adjourn this today. Thank you.